Although emergencies are uncommon in audiology and speech clinics, clinicians must be prepared to respond effectively. This video demonstrates the initial emergency assessment using the DRS-CAB approach. The first step is danger. Ensure the environment is safe before approaching the patient. Check for hazards, remove the danger or remove the victim from danger if safe to do so. Next, assess the patient's response. Tap both shoulders gently and speak loudly. Hello, are you okay? Can you hear me? The patient does not respond. Help! Please call 999 and bring the AED. Activate the emergency response system immediately. Assess circulation, airway, and breathing. Start by checking the carotid pulse. Next, open the airway using the head tilt chin lift technique. Then look, listen, and feel for normal breathing. If there is no pulse and no normal breathing, CPR should be started immediately and the AED used as soon as it becomes available.
Man collapses in a public park. He is unresponsive. What do you do next? Welcome. This guide follows Malaysian Basic Life Support Principles for Cardiopulmonary Resuscitation, or CPR. CPR maintains blood flow to the brain and heart, significantly increasing survival chances until help arrives. Start CPR immediately if the person is unresponsive and not breathing normally. Tap their shoulders and shout to check. Observe for chest movement for no more than 10 seconds. Remember, agonal gasps are not normal breathing. Cardiac arrest is a sudden heart stop. Every minute without CPR reduces the chance of survival by 10%. Before helping, ensure the scene is safe for you and the victim. Check for any immediate dangers. If unresponsive, shout for help and ask someone to call 999 and bring an AED immediately. Place the heel of one hand on the center of the chest, other hand on top, and interlock your fingers. Push hard. Compress the chest to a depth of 5 to 6 centimeters, allowing for full chest recoil. Push fast at a rate of 100 to 120 compressions per minute. Keep arms straight. Perform 30 compressions followed by 2 rescue breaths. Keep interruptions to less than 10 seconds. To give breaths, open the airway using the head tilt chin lift. Pinch the nose and seal your mouth over theirs. Deliver each breath for 1 second and watch for the chest to rise. If it doesn't, readjust the head tilt. If you cannot give breaths, perform hands-only CPR. Continuous compressions are effective and vital. Once an AED arrives, turn it on and follow the voice prompts. It will analyze the heart rhythm. Attach pads to the bare chest, one on the upper right and one on the lower left as shown on the pads. Ensure no one touches the victim. If the AED advises a shock, shout clear and press the shock button. Immediately resume 30-2 CPR for 2 minutes until the AED prompts you to reanalyze the rhythm. Continue until the victim recovers, medical professionals arrive, or you are too exhausted to continue safely. If breathing returns, place the victim in the recovery position and monitor them closely until help arrives.
Choking management refers to a set of emergency actions performed when a person's airway is partially or completely blocked by a foreign object, preventing normal breathing. The main goals are to restore airflow, remove the airway obstruction, prevent deterioration into unconsciousness or cardiac arrest, and ultimately save the person's life. Key objectives include restoring breathing immediately, dislodging the obstruction, preventing the condition from worsening, and ensuring early activation of emergency help. A 30-year-old man is eating a biscuit while sitting in a restaurant. Suddenly, he starts coughing heavily. He shows clear signs of distress as his hand goes to his throat, the universal sign for choking. Immediate recognition is the first step in saving a life in a choking emergency. In cases of mild choking, the victim has an effective cough, can speak, and air is still passing through. If the person is coughing effectively, this is mild choking. Encourage them to continue coughing to clear the airway. Do not perform back blows or abdominal thrusts at this stage. Simply stay with the victim and monitor them closely. Severe choking is characterized by an inability to speak or cough, silent distress, and possible bluish discoloration of the lips. This is severe choking. Immediate intervention is required as the airway is completely obstructed. Give 5 firm back blows between the shoulder blades to help dislodge the object. Use the heel of your hand. Support the chest with one hand while leaning the victim forward to ensure the object falls out rather than deeper. If the obstruction persists, perform abdominal thrusts, also known as the Heimlich maneuver. Perform upward and inward thrusts to generate forceful air movement to expel the obstruction. Continue cycles of 5 back blows, followed by 5 abdominal thrusts until the object is expelled or the victim collapses. If the victim becomes unconscious, lower them safely to the ground and check for responsiveness and breathing. If they are not breathing normally, this is now a cardiac arrest situation. Start high-quality CPR immediately. Perform 30 compressions at a rate of 100 to 120 per minute, allowing full chest recoil between each. Turn on the AED and follow the voice instructions. Attach the pads and stand clear during the heart rhythm analysis. Early recognition and immediate action in choking emergencies can save a life. Stay calm and act fast.
Now, let's look at the emergency resources and equipment that should be readily available in every audiology and speech clinic. Preparedness is the foundation of patient safety, ensuring that in the moments that matter most, every member of our team is ready to act with precision and care. In the event of a medical emergency, staff should immediately contact emergency medical services by calling 999 and provide clear information about the patient's condition and the clinic's location. Staying calm during this call is essential. Quick, accurate communication can significantly improve patient outcomes and ensure that help arrives with the right information. Every clinic must maintain essential emergency equipment. This starts with a well-stocked first aid kit containing everything from bandages to antiseptic wipes. Additionally, disposable gloves and face masks, standard personal protective equipment, must be easily accessible to protect both patients and staff during any emergency response. Perhaps the most critical piece of equipment is the Automated External Defibrillator, or AED. This device is designed to be used by anyone, even those without medical training. It can automatically analyze a patient's heart rhythm and provide life-saving defibrillation if a cardiac arrest is detected. Knowing how to use and locate the AED is a vital skill for every staff member. Because this is an audiology and speech clinic, we must give special consideration to patients who use hearing aids or cochlear implants. These devices are crucial for their communication. During an emergency, these devices should be handled with extreme care and should only be removed if they interfere with life-saving treatment or if the patient is being moved to safety. Knowledge is power, but practice is what saves lives. Staff should be intimately familiar with the location of all emergency equipment and clearly understand their specific roles during a response. Regular training sessions and realistic practice drills are the best way to ensure that everyone is prepared to act quickly, confidently, and effectively. In summary, recognizing emergencies early, calling for help immediately, performing CPR, and using the right equipment can save lives. Thank you for watching this training video. Remember, your knowledge, your preparation, and your quick actions could truly make the difference between life and death in an emergency situation.